Hey, I'm Melanie Johnson along with my co-host Jen Foster. We are both 13-time best-selling authors. We've published over 2,500 books and made all of our authors #1 bestsellers. We own Elite Online Publishing. If you want to become a best-selling author, look us up at eliteonlinepublishing.com. Now, welcome to the podcast that shares secrets from top industry experts that show you how to get lasting success and results. This is the Elite Expert Insider Podcast. Hi, everyone. This is Melanie Johnson with Jen Foster. Hey, Jen.
Hey, everyone.
All right, we have a subject today. Since I'm over 50, I admit it, it's near and dear to my heart, is menopause. Now, all you men, you may want to say, I am not interested in menopause, but you may be married to someone or have a relationship with someone who is going to go through menopause eventually, or is going through menopause, or is postmenopausal. So you're going to be wanting to know how to navigate through this territory as well. And I just used the word, we're probably going to title this podcast Vagina Depression. I just pointed right here. I went to my doctor. I hadn't been there for a while. I admitted I should have gone, but my doctor retired. And after I got done, I was like, well, that was just depressing. So no one tells you this stuff, but today we have Mache Seibel here, rhymes with Bible, and he's a doctor, and he has written a book, The Estrogen Fix. Not only that book, he has written many other books. He has written How to Eat to Defeat Menopause. So he has a lot of different health books. He's our expert today, and I can't wait to just question him and get to the bottom of the menopause mystery. Welcome, doctor.
I think I'm going to be interrogated. That's what I think.
Well, it looks like you've written over 200 articles and 17 books. So tell us about that and how you got into this. Have you always been an MD, or kind of start from the beginning and then go from there?
Well, I guess I have always been an MD, at least at some level. I mean, when I was in utero, my mother would tell people, this is my son, the doctor. And that was before amniocentesis or ultrasound. So I had an inkling I was going to be a medical student, and then I was going to be a doctor. But I've been a doctor for a while, and it's a very fine profession. It's a very interesting one. I started my career is doing some of the first in vitro fertilizations in the country.
Mm-hmm.
And then my wife had surgery that threw her into early menopause. And it was right after a paper came out called the Women's Health Initiative that suggested incorrectly that estrogen could increase the risk of breast cancer and other conditions. And none of her doctors wanted to give her hormones. So I switched at that time. I transitioned from the, I used to do sperm to term, and now I do womb to tomb. So I do menopause stuff and have been for a number of years. And I did that so that I could be clear about the information I was providing my wife. And since I had been in the infertility world for a long time, many of my patients had aged. I stayed the same, but they got a little bit older and they were entering menopause. So actually my patients came with me at that point in time. So it's been a very interesting journey, and it's its own field. I mean, menopause is kind of to the reproductive years what the reproductive years are to pediatrics. I mean, you're not just a baby, or a child is not just a little adult. They're different, and menopause has different issues than earlier years. So it carries its own knowledge base.
All right, so let's go through the top issues that that menopause brings on to women and start to address those. We'll start at the beginning and work our way in.
Well, the top issues really, of course, every person is different. So what bothers one is just messing with one person may not be an issue for the next. But clearly, the common issues are things like hot flashes. You want me to just stop and continue, or just talk about what are the top issues?
Yeah, let's talk. We can talk about hot flashes. Let's take them on one at a time.
Okay. Well, hot flashes are really an interesting phenomenon. They can be caused by things other than menopause. I mean, it could be the medication you take. It could be a whole variety of other conditions that cause hot flashes, but menopause is clearly the most common. And the reality is what happens is there becomes the thermostat in your brain that regulates your temperature sort of goes wacky in that transitional window of time. And so what happens is blood vessels will actually constrict, and then they'll widely dilate, and then the blood rushes to the surface of the skin to let heat off. And when that heat dissipates, it causes the hot flash, and then the heat is there, and then you kind of get evaporation of that, and people tend to get cold after they have a hot flash. So there's this heat followed by cold. That's the physiology of it. We're starting to understand what causes them. There's some neurons in the brain that are associated with this. But the main reason that hot flashes are a big deal is because they're so disruptive. Number one, people will have a hot flash, and if you're a woman in a meeting, whether you're standing up in front of the PTA or you're the president of the company or in the front of the board of directors, if you're standing there being your strong self, and all of a sudden you have this big red flush and you start sweating, that's kind of a tell. And so it's embarrassing to women, number one. Number two, it's very disruptive for sleep. A lot of women will get a bad night's sleep, and when you don't sleep well, you don't feel well the next day. And then, of course, it's also not enough sleep leads to other issues. But so this hot flash is also in some women who have a lot of hot flashes, really frequent ones. Recent studies have shown that this blood vessel constricting may in fact be associated with heart vessels that are also constricting and may be an indicator of heart disease in women.
Really?
So if there's really frequent hot flashes, it's important that they're not just a nuisance. They're maybe giving you the tip of an iceberg for a medical problem. For women in the workplace, because I know you deal with a lot of entrepreneurs, for women in the workplace, hot flashes are a big deal. And the reason I say that is because studies have come out showing that hot flashes, if you take a study from Fortune 500 companies, and if you look at the number of doctor visits, so this study had 250,000 women who had hot flashes but were treated for hot flashes, and compared them to 250,000 women who had hot flashes but weren't treated for their hot flashes. The women who weren't treated had, on average, 6 more office visits to the doctor per year than the women who were treated. Now, this may not seem like a big thing, but what's happening is that you're missing work, and you're also, it's hard to concentrate when you're always having these disruptive things. If you're not sleeping well, that's going to affect your performance. It may affect your ability to get to work on time. It may affect your ability to be attentive when you're at work. Mood changes can happen when you're not sleeping well and feeling disrupted. And some people have some, cognitive changes from all that. So the impact of hot flashes on business is about, if you amortize this study of 500,000 women, they figure cost about $400 million in loss of productivity and work. If you take the doctor's visits, you take the loss of being there and so forth. If you amortize that to the number of women with hot flashes in the country, hot flashes is a $14 billion problem, a healthcare concern that no one talks about. It's like, who would imagine, if I said to you, what do you think is a healthcare problem that costs the country $14 billion a year? How many people would come up and say, oh, of course, that's hot flashes? No, you wouldn't, it'd be something else. But it isn't. So it's not something that I take as a minor complaint. I don't look at it as a nuisance. I look at it as an important thing that women need to deal with.
Yeah. So what are some of the treatments that you would do for hot flashes?
Well, there are lots of treatments. We could spend an hour talking about that. But in a thumbnail, the most effective treatment is hormone therapy. And we could talk about that. It is safe and effective for the majority of women. And we can talk about that too in a moment if you'd like. But then there are non-estrogen specific treatments for hot flashes. There are medications that can be used that are prescription medications, prescription non-estrogen medications. There are some over-the-counter products that can be used, products like soy, black cohosh. There are a variety of proprietary blends that they sell at drugstores. Exercise, if it's not done right before bedtime, can be very good for lowering hot flashes. And there are some new medications now that are quite interesting that are addressing these neuropeptides in the brain that give you those that are specific to those neuropeptides, and those are just coming out on the market. And then, of course, there are things that are completely non-medical but are effective, things like cognitive behavioral therapy, where it's kind of a hypnosis type of a thing. That's probably the alternative approach that's got the most data on it that can be effective. And then there are a number of other treatments that can be used. But there's a lot of treatments for hot flashes, and I recommend if you have them, to go talk with somebody that can help you, and either a doctor or coach or somebody who can help you get through this.
I've kind of noticed the hot flashes, like for me, it's even addressed to, it could be something that I'm eating, like after I eat carbs, I tend to get a hot flash. If I was just stressed, I tend to get a hot flash. After I urinate, I tend to get a hot flash. It's interesting how just normal type things all of a sudden will trigger it.
Well, caffeine is one, alcohol can be another. These are common ones. If you eat a spicy food like a red hot chili pepper or something like that, sometimes being in too hot of an environment can do it. That's why you'll often see women dress in layers, because they feel cold and then they get hot flashes, and then they're stripping down to the next layer and then they put them back on and so forth. So this is very common. And there's a lot of products that are out there now to try and cool people down, anywhere from throwing a bag of peas under the frozen peas under the pillow to cool it down, to sheets that wick off sweat, to mattresses that change the temperature to cooler. There's a number of products that address this kind of a thing. But if you can, hormones are by far the most effective in terms of taking care of that problem. As I tell women that I see, everything works for somebody and nothing works for everybody.
Right, right. So let's go on to the next issue. So what's another issue for menopause that comes up?
I think, well, of course, irregular cycles are very common, bleeding abnormalities, because if you remember back to when you were in puberty or going into puberty and you're starting to get your first period, during that point of time, the hormones, estrogen and progesterone, which are the primary ones in women, go from basically a very low level to the reproductive age. But those hormones, in order to prepare the uterine lining for pregnancy and in order to incentivize the egg or get the egg timed right so it's released, are very synchronized. These are very synchronized patterns of release. In puberty and in perimenopause, that year or so, that window of time, peri means around, like the perimeter. And so in that window of time around menopause, those hormones get unbalanced. They're like paired figure skaters that aren't working together anymore. And so the imbalance is what ends up causing those kinds of irregular periods. And they are also what causes the mood swings that are coming with it. It's like being in PMS all the time. And that's what makes the mood so hard. And of course, we alluded to, because all of these things are, I talk about with women trying to help them take care of the sum of you and not just some of you. And all of these things are related to each other. These symptoms are interconnected. They go together. So if you have hot flashes, you don't sleep. If you don't sleep, then you get cranky. If you have these imbalanced hormones, you can't sleep too well, and you have these mood swings, and you can get cranky, have forgetfulness, and so forth. So all of these things are connected. Sleep is another one of the big things that happen because the disrupted sleep, and also hormone levels. While they're like the stock market, whether the stock market goes up or the stock market goes down, it doesn't make a straight line. It does like this. And hormones are doing like that too. And when they start to drift down, some nights you sleep well and some nights you sleep poorly. And that slow loss of estrogen drifting in the lower direction is affecting the REM sleep, the REM, or the rapid eye movement sleep, which is some of the restorative part. It shortens that window of sleep. Because when you sleep, you have these 5 phases of sleep, and you don't just have one all night long. You have one, then you have another one, you have another one. So you're going through a series of cycles of sleep. And the pieces of those cycles, the REM part of it, the tip of it, is shortened. And so that doesn't give the restorative part to the, when you're get up, you just wake up tired. And that's what people will say. So that's another one. You know, your mojo is a no-go. That can be another one. And once more, you know, people will have the disrupted sleep. They're not tired. They feel tired. They're not rested. The lack of hormones can cause, we were talking about, what did you call it? The vaginal, what did you call the talk?
Vaginal depression.
Vaginal depression. Okay, so vaginal depression, my interpretation of that word, though it's a new term for me, it would be when the estrogen gets low, the vaginal tissues flatten and they get drier and they shorten. Because what happens is in the reproductive years, when the hormones are at their peak, the lining of the vagina is corrugated. What that means is if you've ever, you know, when you put your hand through your sleeve of your sweater and it expands to let your fist out and then it comes back down, the vaginal tissues has rows of mucosal folds. And so those folds with elastic tissue allow it to expand, and the babies can come through there and then it goes back. And it accommodates, if you have relations with intimacy, it's able to, you know, to be firm around the partner. So that enormous variation is made possible because of estrogen's magic on the tissues of the vagina. When that estrogen is low, and eventually quite low, the folds in the elastic rugae is what they're called medically, they flatten. And then the tissue no longer has distensibility. It's just a fixed diameter. And so with intimacy, it hurts to separate. And that's why local estrogen can be very helpful in that setting, or other things if you don't or can't take it. So
then they're saying if you're not sexually active, or if you're married and you haven't been so much sexually active, you know, a lot, as that happens to couples, but then when you do, then you can't necessarily go back unless you do the estrogen. But it's like you have to, it's not like working out. That was the big thing for me. It's like, oh, well, it's like a muscle. Like you just get back in shape and you'll be back where you want. And like, no, it doesn't happen that way. So kind of go into that. Even if you take estrogen, it doesn't sound like you're gonna, you know, be back to full tilt.
If you, I mean, there is a little bit of use it or lose it in that regard. But if you do have regular sexual relations, the actual action of doing it serves as a dilation, if you will, and it helps to keep it moist. What happens is that the lubrication that comes into the vagina is not so much a gland that's squirting it in. Mm-hmm. What it is that the vessels on the outside of the walls of the vagina dilate with the sexual arousal. And then what happens is the fluid, little bits of fluid go into what's called the interstitial fluid. You have the vessel, and then you have this kind of loose tissue, and then you have the wall of the vagina, and it kind of is a sweat. So the vaginal lubrication is actually equivalent to sweating. And it's the same way you release sweat on your face. Blood vessels dilate, and then the fluid comes onto your forehead or your cheeks or whatever. It's the same thing. And what happens is those vessels and those tissues, as they shrink, there's less vessels and less size vessels in there, and so it becomes drier. And so if you do have intercourse and you have relations, then the arousal allows those tissues to remain more stimulated, and so it stays moist longer. But for some women, they will continue to shrink. Hormones, though, will make those tissues be restored, and so that's a good thing, but it is a muscle. If you don't use, you get sore when you work out. So if you're having that problem and you address it and you take care of it, or you just want to get back into it, just because you've been out of it for a while and you're able, you still may have to have a little bit of tenderness and understanding initially when you get back into the game, because those muscles may be a little bit sore from too aggressive going after it. But if you can be patient and understand that's reasonable, that happens, it will probably adapt in many instances and you won't need to be treated. Just be patient, have a partner who's patient, and take your time. And if it doesn't go all the way the first time, or it's a little sore, fine, okay, that's not the best way to have it, but understand that the next time may be better, and so forth.
Do you ever recommend the new O shot, they're calling it? Have you heard of that?
Tell me what it is.
The O shot. It's where they use your blood. They separate your blood and the platelets of your blood and then inject it. Have you heard of that?
Yes, they're doing that for the scalp. I tried it. Look what happened to me. No.
I just wondered if you'd heard of that, because I heard of some people talking about that.
They're using the platelets. I didn't know it by that name, but they're using the platelet injections. They're using lasers, to try and rejuvenate and so forth. Hormones will do the same. The platelets. This is not standard.
It's all
treatment.
new, yeah.
What it'll be, we'll see. Ask me in 5 years, and then we'll see if it worked.
Yeah.
The lasers that they're using in the vaginal tissues to try and get moisture back, or for that reason, they do work, but they're expensive. It's about $1,000 a time. You have to do it about 3 times, and then in a year you need a tune-up. What it does is it punctures little bitty holes in the walls of the vagina. The blood vessels come in, and it sort of is a way to mechanically stimulate blood flow into the vaginal walls. And it's effective, it's expensive, but you get the same benefit from local estrogen.
Yeah, I was gonna say, taking estrogen sounds easier and less painful.
A lot easier. And the thing is, for women who are worried about taking hormones because they have cancer or for other reasons, local estrogens have been studied, and there's been opinions put out by the American College of Obstetricians and Gynecologists, and they feel that it's safe even in women who have had prior estrogen receptor positive breast cancer. Because, what happens in Las Vegas stays in Las Vegas. What happens in the vagina doesn't 100% stay in the vagina. Minuscule amounts of it get into the bloodstream, but there's been no evidence that vaginal estrogen has caused a greater risk of death or recurrence. And so if other lesser or conservative methods don't work for you, you can try local hormones, and you don't really have to feel afraid of that. At least that's the opinion of the American College.
So maybe it's the oral estrogen that's a higher dose that you're taking. That way has the higher effect. And does that do the same thing as the local estrogen?
Well, for most women, the oral or topical estrogen will make the vaginal tissues heal or rejuvenated. But the most benefit of that is that the reason that hormones are interesting is because what happens in menopause? I mean, you hit foggy thinking, your skin changes, you have, your breasts may sag, you get changes in your skin, you get changes in your bladder gets sensitive, you have vaginal dryness, the bones can thin, all of these things
Doesn't all that sound wonderful? I just can't wait. Aren't we all looking forward to that?
Aging is not pretty, but you know what? If you exercise, keep your stress down, if you eat properly, and if you go about your life in a really good way, most of these things are lessened. And the point I wanted to make was that hormones addresses every one of those body parts, because those cells were intended to receive estrogen. Hormones work because they have receptors on the cells that are supposed to take them or use them. Yeah. And when the cells that don't use estrogen, they just ignore it. You have to have the key to the lock on those cells. So what ends up happening is that when you try to treat your symptoms without hormones, then you have to really be methodical. If you're having an issue with your mood, that has to be treated in one way. If it's your sleep, it has to be treated with another thing. If you have issues with your bones getting thin, you have to treat that a different way. You know, and each one by one by one. And so you do have to take care of the sum of you. But if you do use hormones, then it's very, very effective. And I'll just digress for 1 minute, because the hormone thing is one of the biggest questions that I get asked about. And I've been all over the country talking about hormones. And I can tell you, there's a lot of what I call myth information, a lot of myths out there. And the reason that the hormone story got so distorted is because when they did the study that was so damning, what it ended up doing was they were comparing women. The study had women in it that were between the ages of 50 and 79. But the women who got the hormones were 75% between the ages of 60 and 79. And the women who got the placebo were between the ages, 75% were between the ages of 50 and 59. So the whole study that made all the problems and the issues were comparing largely 50-year-olds with 60 and 70-year-olds. And so women who are 60 and 70 are going to have more medical problems than women who are 50s. When they took the 25% that were all in their 50s and they superimposed them, the problems basically went away. But it was created an enduring myth that hormones are bad. It's so much wrong that those women who take estrogen by itself actually have a lower risk of breast cancer than the women who took the placebo. Women who have a uterus have to take both estrogen and progestin of some kind, progesterone of some kind, because estrogen alone on the uterus will cause breast cancer, will cause uterine cancer, because the estrogen builds up the uterine tissue, and then the progesterone, which is progestation, that's what it gets its name, compacts that uterine lining so that the embryo can stick to it. So you have to have both, and then you have a period, it sheds, and you start all over. But with no uterus, you don't need progesterone. So you just need estrogen. And in the estrogen-only study, the women who'd had a hysterectomy had a lower risk of breast cancer. And so now,
but that's only if they had a hysterectomy. If you still had a uterus.
If you have a uterus and you have estrogen and progesterone, and it looks like if you have estrogen and progesterone, like the natural progesterone and not synthetic one that was used in that study. Unfortunately, in that study, when it was started, there was no oral natural progesterone, bioidentical progesterone. They only had this one synthetic one, and that progestin, which was called Provera, medroxyprogesterone, that's the culprit. That's the problem, but not the estrogen. And so if you have it estrogen and its own progesterone, with just plain progesterone, there doesn't seem to be much of any problem there. So even if you have a uterus. So, there's a lot of, as I said, a lot of myth information.
Yeah. Oh, Jen, we can't hear
I was
you.
muted. There's a lot of information about this, and I'm sure a lot of it is in your book, The Estrogen Fix. But
it really is, yeah. This book is been recommended by the North American Menopause Society for women and also for doctors because it's so well indexed. Even though it's written in simple to understand words, I have it divided up in an interesting way because not everybody wants to know everything about hormones, but I get that. So if you want to know about your vagina, go to that one, your skin. If you want to go to the part about your brain, go to that one. If you want to go about your breasts, go to that one, or your heart. All of these are separated in that way because it's easier for people to, go after what they want.
Yeah. Well, tell everyone where they can go to find the books and find more information about you so they can get all the information they need.
Well, the books are pretty much everywhere. It's on, they're on Amazon's probably the easiest way to get them. They probably have, and to find me, you would go to drmache.com. That's basically my first name, M-A-C-H-E. So it's drmache.com. And the doctor's always in.
Thank you,
That's
Dr.
great.
Mache. We really appreciate you coming on. Well, you answered some of my personal questions. Thank you very much. And so all of you out there, to me, the lesson learned is have as much sex until you hit menopause as you can, because it will be more
And keep
enjoyable.
having it.
And then keep having it.
Keep having it and keep having it so you don't lose it. That's the key.
Exactly.
And if you need a coach, menopause coach, talk to Dr. Mache.
Yeah,
There you go.
menopausecoach.com. I'm actually there too.
Terrific. Well, we'll see you next time. Make sure you subscribe to this podcast, and maybe we'll have something on menopause instead of menopause next time. So good to see you
Thanks,
all.
Fran.
Make sure you subscribe, and we'll see you next time.
Have a great day.
Hey, are you looking to increase your revenue, build credibility, and elevate your brand? This podcast is brought to you by Elite Online Publishing, an innovative publishing and full spectrum marketing company. They will publish and market your book to make it a #1 bestseller. Becoming an author is the best way to market your business. So contact them at eliteonlinepublishing.com today. All of their authors become #1 bestsellers.